This clinical case is about dysentery. So the patient scenario is that the traveler is from America and he's visiting Vietnam for 3 weeks. Within the first few days upon arrival, the traveler went to a hospital with severe diarrhea and abdominal pain. During the examination, I asked where they're from and they're American, how long they've been in Vietnam, which has been only 5 days, when the diarrhea began, which was 2 days ago, and if they've been consuming locally prepared food, and they have from the street vendors, and consuming tap water or unpasteurized foods, and they've been consuming tap water at local restaurants. During the physical examination, some of the signs I observed were that the patient had a high fever of 102 degrees Fahrenheit, and the symptoms the patient described to me were that they were having abdominal pain in the intestinal region as well as diarrhea 5 times per day containing blood and mucus. From the signs and symptoms of the patient, I decide to run some tests to determine if the diarrhea is being caused by bacterial infection or parasitic infection. The stool culture, and the stool gram stain test will determine if there's bacterial infection, while the ova and parasite test determine if there's a parasitic infection. The first test was a stool culture test, and it's used to identify if there's a bacterial infection in the patient's GI system. And the materials needed are a stool sample from the patient, a McConkey agar plate, a bacterial streaking technique. And it is done by taking the stool sample and streaking it onto the McConkey agar plate and then incubating it. And if there is growth on the plate, this indicates the presence of infection-causing bacteria. No growth on the plate indicates that there is no infection-causing bacteria in the patient sample. And also, the color of the growth can determine which bacteria is causing the infection. The second test is a stool gram stain, and it's used to identify the type of bacteria causing the infection to the patient. The materials needed are the patient's stool sample, staining materials, and a microscope. It is done by taking some of the stool sample and smearing it onto a microscope slide, then staining it using gram staining techniques and looking at it under the microscope. The stained stool smear will help identify the types of harmful bacteria inside of the patient's GI system by looking at the morphology, arrangement, and color seen in the smear. The last staining technique is the ova and parasite test. It's used to identify if the patient has a parasite in their GI system. The materials needed are a stool sample, staining materials, and a microscope. And it's similar to the gram staining test, except that acid-fast staining is used. And when you're looking at the sample under the microscope, you can determine if the patient has a parasitic infection. And if they do, then a different course of treatment will be required compared to if they have a bacterial infection. So the test results show that the stool culture was positive, meaning that there is bacterial growth on the agar and it has been identified as Shigella. The stool gram stain test also had bacterial presence, and the gram-negative stain identified Shigella in the stool sample smear. And lastly, the ova and parasite test was negative, so there's no parasitic infection in the patient. From the culture and gram test, I can confirm that the bacteria causing diarrhea is Shigella, and Shigella is a gram-negative prokaryotic bacteria that is facultative anaerobe, and the morphology is rod-like bacillus, while the arrangement is singular, with some being streptobacillus. And it's not part of the normal human microbiome, but is found in the feces of infected individuals. Other areas that it can be found are on surfaces that infected individuals have touched and water that the infected individuals have contaminated. Since we found Shigella in the patient's stool sample, I can connect the signs and symptoms and the background information of the patient to bacillary dysentery, which is a disease most often caused by the Shigella bacteria. It infects the gastrointestinal system, causing soft or liquid stools containing blood or mucus. Some of the signs and symptoms are diarrhea containing blood and mucus, a high fever, nausea and vomiting, and abdominal pain. And I'm pretty sure that it's bacillary dysentery because the patient is not from Vietnam and they drink contaminated water, which is very often the cause of dysentery for travelers. There is no vaccine or medicine to treat bacillary dysentery because it's typically not needed, but the treatment for this disease is that the patient must have an adequate food intake in order to prevent dehydration caused by bacteria, and sometimes painkillers can be used if they have headaches, and they must avoid antidiarrheal medication and contact with other people, but their symptoms will improve within 3 to 7 days. And the online source I recommend to this patient is from the Cleveland Clinic about dysentery.